Hi, I'm Dr. Heather Hirsch. In today's episode, we are going to talk about one of the most requested topics on my channel, and that is what is the best type of vaginal estrogen for you. Now, disclaimer, vaginal estrogen is prescription only. So after watching this video, you are going to need to take some notes and go to the clinician, or you can come see me and my team at the Heather Hirsch MD Collaborative. It's the private telemedicine practice that I founded. But we're going to talk about the pros and cons of each kind of vaginal estrogen. If you are ready to get into it, let's go. The first thing you may be asking yourself is, why the heck do I want to use vaginal estrogen? Well, during periods of a woman's low estrogen state, this could be postpartum, this could be perimenopause, and definitely post-menopause and beyond. Because of those low estrogen states, we can get a condition called genitourinary syndrome of menopause, or GSM for short. Now, if you're a nerd like me, then actually what's happening is that during those periods of low estrogen, the vaginal tissue, and it's not just the vagina, it's also the vulva and the labia and the vestibule and the clitoris, goes from an acidic pH of around 5, which it likes and functions best at, to a more basic pH. And in this basic pH, the tissues don't work as well. The cells don't get the message to make moisture and lubrication, and the blood flow to the area is just not as good. So the genitourinary tract really functions best with a lower pH at around 5. And without estrogen, the pH is going to increase. So a lot of women notice symptoms of GSM, such as lack of lubrication, vaginal dryness, pain with intercourse, and even recurrent urinary tract infections. And when you notice these symptoms, again, it could be postpartum, perimenopause, or menopause, the best way to treat them is to bring the pH back down by using vaginal estrogens. Now, you may be actually asking, is vaginal estrogen safe for everyone? And the TLDR, or the too long, didn't read, short answer is yes. Vaginal estrogen is safe for all women on the planet. And this is because local, topical, vaginal estrogen, all words to say estrogen that's in a prescription form that is just for GSM, does not travel systemically. Now, interestingly, there is a black box warning on all vaginal estrogen products that say this could increase the risk of breast cancers and heart attacks and strokes and all these bad things. And unfortunately, that black box label is based on the Women's Health Initiative, where they were studying the impacts of oral conjugated equine estrogen and medroxyprogesterone acetate in women's systemic hormone therapy. Local, topical, vaginal estrogen is safe for all women, even if you have a history of breast cancer, actively undergoing treatment for cancers, had a heart attack or stroke, or clot in your lungs. All women can use vaginal estrogen. You're gonna say, oh, but I still need a prescription. Yes, in this day and age, you do still need a prescription. Again, reminder, we prescribe vaginal estrogen at the Collaborative all the time. All right, now that we've gotten through some of the important topics of why do you need it to treat GSM, when do you need it, postpartum, perimenopause, and menopause, who can use it, everyone, let's talk about the different options and their pros and their cons. Let's start at the top of the list with vaginal estrogen creams. Now, there's two brand names that you may have heard of. There's Estring and there's Perimenopause cream. Estring is bioidentical, and all bioidentical mean is that estradiol is more plant-based, whereas Perimenopause is made from conjugated equine estrogens, i.e. horse's urine. Now, does it make a difference in terms of efficacy? There's not really been head-to-head trials, but truthfully, no, I see both work extremely well. I tend to use the estrogen creams as first line when patients tell me they have significant pain with intercourse. When I hear things like, it feels like shards of glass, or it burns when I urinate, or it burns if I wipe, and it's really, really severe, I do think you should use a cream first. Why? Well, because it's a cream, it really can probably get more surface area. More surface area means more increased likelihood that you're gonna treat that tissue and do what you gotta do, which is bring the pH down. So I usually prescribe creams 2 to 3 times a week. And I usually prescribe, if we're using Estring cream, 1 to 2 grams, 2 to 3 times a week. Or Perimenopause, we can actually get away with a little bit lower amount because it's a little bit more concentrated, 0.5 gram, 2 to 3 times a week. Now, in all honesty, you can use estrogen creams nightly if you wanted to, because again, remember I said it does not travel systemically, so it really doesn't, it's not going to increase your serum levels of estrogen. Women who take postmenopausal vaginal estrogen have the same levels of estrogen as postmenopausal women not on hormone therapy. Does not travel systemically. Another pro to the creams is that they're very versatile because it's gonna come in like a little tube that looks like a tube of toothpaste. And you can put some on your finger and you can apply it to the tissue externally that is also dry or sensitive, or lost sensitivity is another way of saying it. The clitoris, the vulva, the introitus, the perineum. You can really use it externally, which is something that you can't do with the other options. The cons of creams is that they can be messy. What goes up must come down. So if the mess is going to be something that you really can't hack, it really bothers you, it's affecting your life, cream may not be the best long-term option for you. And hey, I get it. Nobody wants to feel, like their underwear is always messy. It can be extremely effective if you have really extreme pain. I do definitely kind of nudge my patients to start with this and then move to something like the suppositories or the rings a little bit later on because of how effective the cream really is. Let's now move to suppositories. The most common forms of suppositories or names that you're going to hear are Vagifem or the generic Uvifem. Now, suppositories are like these little teeny tiny tablets. It might even look like, a little size of a little candy even. And they're gonna come with an applicator, just like what's gonna look like placing a tampon. And you're gonna use the applicator, put it into the upper 1/3 of the vagina and throw that applicator away. Each applicator is disposable. Now, the suppositories are great for mild to moderate discomfort, especially if a woman can't handle or does not like the idea of those creams, which again, what goes up must come down. So they're less messy, but they do tend to be less effective. And that may be because it's just reaching less surface area. And you also don't have the flexibility of, say, applying it to the area like the labia because it's in a pill form. So those are the downsides to Vagifem and Uvifem. Now, same with the creams, you could do any frequency that you need. So I typically start with twice a week, but I have some patients who use it 3 times a week or 4 times a week, every other night. And that can be really helpful. Also, I should note that when patients have severe atrophy, sometimes the pills themselves won't even get absorbed. And sometimes you can see the whole pill come out in your underwear, and therefore I really do think if there's something that you see, time to go back to the cream, even if it's just for a little bit of time. There are also inserts that you can apply with your fingers. So this is Imvixi and Perastrone. Now, these are actually 2 different ones. Perastrone is actually not estrogen. It is DHEA. I'm going to talk about that in a second. Imvixi is a small jelly bean-like insertion or a suppository that you put in yourself. It is somewhere if almost like the creams and the pill had a baby because it's not as messy, but it is once it's absorbed just a little bit creamier, or it just absorbs a little bit easier than the suppositories. Whereas Imvixi, you're just putting in with your finger. The only other con or downside to Imvixi is sometimes it is a little bit more expensive. And it comes in a starter pack where you're going to use one insert every day for 2 weeks, and then a maintenance pack. And the maintenance pack is twice a week. And because of the maintenance pack and the way it's actually packaged, it's harder to increase the frequency. You'd have to see if basically the insurance company would let you use 2 maintenance packs a month so that you could do if you needed to increase the frequency, not just twice a week, but say 3 or 4 times a week. So that could be the downside to Imvixi. Perastrone, on the other hand, is a nightly suppository of DHEA. This is not actually estrogen, but it converts in the cells to estrogen and androgens. And androgens can be really important. In fact, the vulva, the vagina, and the tissue of the genitourinary tract is very rich in both estrogen and androgen receptors. So a lot of my patients actually really find immense benefits when they switch to Perastrone, or its brand name is Interosa, which again is DHEA. Now, this also can be a little bit more costly. So this is a nightly suppository. So you put this in with your finger. It's nightly versus Imvixi, which is the maintenance dose is the way it's packaged is twice a week. And some people notice it helps when they've tried different forms of estrogen and it hasn't really been, reached that, this really is helpful. Sometimes switching to the DHEA and switching the formulation of the medication is really what helps. Lastly, there's the Estring, or as I like to call it, the E-string. And the E-string is one of my favorite methods because it's a set it and forget it. It's basically gonna look like a little, almost like the size of like a hair tie, and you're gonna pinch it and stick it up behind the cervix, or even if you've had a hysterectomy, it can sit behind the vaginal cuff and stay there for 3 months. It is a great set it and forget it. So many women tell me that they'll be really good with their vaginal estrogen for a while and then just kind of drop off. That's how I am with flossing my teeth, to be totally honest. I'm really, really good for a while, especially if I'm going to the dentist, and then I just kind of forget about it. And if you don't use the vaginal estrogen consistently, guess what happens? The pH is gonna go back up to that basic pH over time, and those symptoms of GSM are going to return. So all vaginal estrogen products, and GSM in general, it is progressive, meaning it's not going to get better with time. And if you are finding relief from some vaginal estrogen, we always say this is yours till the end of time. So you do want to find something that can be, on a schedule that you're good with and that's reliable. And so listen, that can be hard. And so the E-string is great because you just put that in, you leave it for 90 days, and you take it out after 3 months and you put in a new one. You could do this yourself. It doesn't need to be inserted by a doctor, although it could be if you wanted it to be. Now, what about intercourse? You may be asking. You can leave it in for intercourse. You could take it out. It only absorbs when it's next to a mucous membrane, so nothing's gonna happen if you take it out for intercourse, but nothing would happen to your partner if they're a male if you have the E-string in place. The downside is cost. It can be a little bit costly, but it can be so worth it if it is just a great reliable method for you. I said something about the E-string that's really important, which is any of these vaginal estrogens going to bother or hurt your partner, whether they're male or female? No, the answer is no. You can absolutely use these, and it is all about preference, but it's not going to hurt your partner in any way, shape, or form. And lastly, something that I tell my patients all the time is that you can use more than one method at a time. For example, I have some patients use the E-string and they have estrace, so they can use it on their finger and apply it topically. You could do the suppositories and the estrace. You could do the Invixi and the E-string, or Parastrone and the E-string. You can actually use more than one modality. This is absolutely so freeing for patients to know because sometimes they just need that much TLC. The last myth that I get on this topic is, if I am on systemic hormone therapy, can I still use vaginal estrogen? Oh my goodness, yes, yes, yes. 40% of women on systemic hormone therapy, that means pills, patches, sprays, and gels, do need to use local vaginal estrogen because this is where there is the highest density or concentration of estrogen and androgen tissues and cells. And again, remember, I mentioned at the beginning of this video that you really need to bring the pH down to that more acidic pH, and that is where the vaginal tissue, the clitoris, the vulva, the urethra, and the bladder are all gonna function at their best. If you love this video, please give it a like, follow, send it to your bestie who needs to see it. Definitely subscribe to the channel. It's free to do so, and it's telling the YouTube algorithm that this is the best place for all things evidence-based when it comes to perimenopause, menopause, hormone replacement therapy. I'm Dr. Heather Hirsch. If you don't know me, I am a board-certified internist. I founded the Midlife and Menopause Clinic at the Brigham and Women's Hospital, was faculty at Harvard Medical School, and then in 2023 started my own private telemedicine practice, the Heather Hirsch MD Collaborative. We see patients in all 50 states. I have amazing clinicians that work right alongside me who are just dying to see you. We do hour-long visits and we individualize your care, and they all really have the same philosophy that I do when it comes to the safety and efficacy of FDA-approved hormone replacement therapy. If you are a clinician, definitely check out the Heather Hirsch Academy. That's where I have all my courses, changing clinicians' lives, getting them to love their job again so that you can feel just as confident teaching your patients about perimenopause, vaginal estrogen, and all the things. Check out all the links below in the description, and I'll see you guys next week for a brand new episode.